Now, ahead of tomorrow's World Cancer Day, today we're shining a spotlight on breast health and how best you can look after yourselves.
We are joined now by consultant breast surgeon Siún Walsh, who wants us all to be more breast aware. Siún, great to have you with us on the show. When it comes to the breast, of course, we get so worried straight away that we think it's cancer, but a lot of people who present, it is completely benign. Can you tell us a bit more about that?
So we get a lot of referrals to our clinic and we see several hundred patients a week. And in fact, only about 10% of patients we see end up having breast cancer. We see a wide range of benign breast disease, including simple things like breast pain and benign lumps that sometimes need to be removed and sometimes don't. But obviously, attending a breast clinic is a major cause of anxiety for people. And so we do want to reassure you that just because you're referred in doesn't mean you have cancer.
But Siún, I suppose it is very, very important to say that no matter what, you should get checked out.
Absolutely. I think the main thing is to remain breast aware. And as we all know, it's very difficult times out there. And it's hard to remember these things and the simple things for looking after yourself. We would just recommend that you know what your own breasts are like and what's normal for you so that you can detect a change and act quickly. I would recommend that you look at your breasts in a mirror regularly and just look for any changes in the size, the contour, any skin changes like redness or dimpling, any changes in the nipple. Also watch out for any nipple discharge, which you might notice in your bra, especially bloody nipple discharge. It's also a good idea just to check your breasts and your armpits for lumps. The best time to actually do that is after your period has finished, and it's easiest to do it in the shower. If you do notice anything you're concerned about, either in the mirror or you find a lump, go and get checked out by your GP. Your GP can then examine you and see if you need to be referred into a specialist breast service where we'll be happy to look after you.
Now, Siún, when you do get that referral from your GP and you do come to a specialist breast service, is it just a mammogram or would some people be sent for an ultrasound as well? What happens?
So obviously, attending a breast clinic can be very nerve-wracking for patients. And so I'll just take you through what happens. Generally, you'll be seen by a specialist. That might be a specialist nurse or a specialist doctor. They'll talk to you about what your concerns are and why you're there, and also have a chat to you about what your risk factors for breast cancer are. Then you'll be examined, and based on your age and what's found in the examination, you'll generally have a mammogram if you're 35 or older. And if we notice anything of concern or anything abnormal at all on your examination, then you'll generally end up having an ultrasound as well. If there's anything abnormal on the mammogram or ultrasound, you may end up having a biopsy, which is done under a local anaesthetic in the clinic or in the radiology department. Then about 2 or 2.5 weeks later, we'll have results available and be able to guide you on what needs to happen next. And that's generally what happens in our clinic.
Siún, it's a very worrying time for anyone who's facing into this. Would it be a good idea to bring a friend or a family person with you on the day?
So unfortunately, with COVID at the moment, we've made lots of changes to our clinic setting to make things as safe as we can for the patients. And sometimes this involves not bringing somebody with you. We do make some exceptions, and so it's a good idea just to phone up in advance if you feel that you may need somebody to come with you. But to be honest, at the time of an initial visit, it's often not necessary when you're just being assessed and having investigations.
Siún, can you tell us a little bit about if, of course, unfortunately, breast cancer does occur? Are there multidisciplinary treatments these days? And tell us a little bit about the advancements.
So for breast cancer, we've got many modalities of treatment at the moment. And that's actually a really good thing. And it's one of the reasons why outcomes for breast cancer have been improving year on year. And our outcomes are now very good. There's sort of 5 main components. The first is surgery for the breast, and that's my end of things. Some people will end up needing chemotherapy, also radiation therapy. There's also hormonal therapy, which is given to reduce the amount of estrogen in your system, which may be encouraging a tumour to grow or recur. That's given by tablet form generally. And then there are also newer targeted therapies, such as Herceptin, which targets HER2. Now, some women will end up needing all of those 5 types of treatment. And then on the other end of the spectrum, some women will just end up needing surgery and radiation, or for some women who are diagnosed much later on in life, a tablet might be sufficient to manage their breast cancer. The extent and types of treatment that you receive will be based on many factors, such as your age at diagnosis, the size of the tumour, and also whether the tumour has spread into the lymph nodes or beyond the lymph nodes into other organs such as the bone or liver. And also we test tumours to see if they're sensitive to hormones such as estrogen or progesterone. And now we're looking at a receptor called HER2, which every breast cancer is now tested for, to see if you might be a candidate for targeted therapies such as Herceptin and other newer agents. We also have a newer test called Oncotype DX, which we use to test tumours which haven't spread to the lymph nodes and are estrogen sensitive. And this is helping us to decipher which women may need chemotherapy and which women don't need it at all. In terms of breast cancer surgery, we operate on both the breast and the armpit or the axilla. For the breast, sometimes a lumpectomy is sufficient. That involves just removing the tumour and some normal breast tissue from around it. However, some women will go on to need a mastectomy. That means removing the whole breast. But that can be usually done in conjunction with a reconstruction, performed either at the same time or at a later date. For the armpit, usually in the past, we used to remove all of the lymph nodes. But now, if there doesn't seem to be any effect on the lymph nodes, we can just remove a couple of the lymph nodes, and that's called a sentinel lymph node biopsy. We've come on a long way in recent years to paring back the surgery that we do, and we really try to preserve the breast wherever we can.
Siún, we've only 1 minute left. What can someone do to reduce the risks of getting breast cancer?
So there's increasing evidence in recent years that maintaining a healthy lifestyle can actually reduce your risk of breast cancer. So we do advocate a healthy diet and taking regular aerobic exercise. And also reducing your alcohol intake can help. If you're taking hormonal medications such as hormone replacement therapy or the oral contraceptive pill for a prolonged period of time, this can slightly increase your risk of breast cancer. And so it may be a good idea to talk to your GP about either stopping it or getting checked frequently for breast cancer. In terms of exercise, we're actually launching a very exciting new collaboration with Xwell and Novartis, where women at high risk of breast cancer and women who have breast cancer will be offered a tailored program for exercise to hopefully reduce their risk of getting breast cancer and or having it for a second time.
Great.
So
Siún, thank you very much, Siún. Unfortunately, we're out of time. Thanks for that information. As always, of course, if you have any health concerns, if you are worried about breast cancer or anything else, do consult your GP. And if you want more information on breast cancer, visit the HSE at hse.ie.